Stop for a moment and imagine your beautiful little baby girl is 3 months old. Now imagine her eyes rolling back into her head and her body becoming rigid and trembling as a seizure takes hold. That's exactly what happened to our little girl, Mickie.
There are now more than 8,000 known rare diseases. Most of them are genetic disorders. Taken together, they affect more people than those living with all cancers and all HIV combined. So just in the United States, you've got more than 30 million people diagnosed with a rare disease. The majority of them are children. Many of those rare diseases involve the brain, and many of them involve seizure disorders, either as a symptom of the disease or oftentimes as one of the primary causes of leading to the health challenges that could lead to severe disability or even death.
Epilepsy continues to be stigmatized. I think some of it relates back to cultural and even religious beliefs. The first reference, actually, to epilepsy is in the Bible, where someone who is, quote unquote, possessed by the devil was really having an epileptic seizure. And those individuals were often sent to the desert to fast and pray so the devil could be exorcised, if you will. But that's actually a reference to the ketogenic diet. Fasting produces ketones that would stop seizures.
So my son Hunter started having seizures at 6 days old, and it was the worst, darkest hour of my life.
We told them we were concerned and wanted to get treatment right away. They said it could take 6 weeks to get approved, the insurance. So I didn't want to wait. I just took him to the ER.
When Owen started having seizures, he was having focal seizures. And there's a lot of research out there that tells you kids will grow out of it and it'll be fine. And as long as we were staying in that focal seizure life, maybe he would have a chance. So when we got that infantile spasm diagnosis, I mean, I just knew it was going to be a long journey after that.
Families can deal with difficult diagnoses. They can handle raising a special needs child, but they can't handle knowing they could have done something, but they didn't because they did not know. That is criminal. That is not acceptable. And it is our role and our responsibility that we're taking on to allow children to have the opportunity that Mickie now has because we got to the care that we did urgently. Epilepsy is a catastrophic problem. More people live with epilepsy than autism, cerebral palsy, Parkinson's, and multiple sclerosis combined. 1 in 26 people will develop epilepsy in their lifetime. And unfortunately, the federal government spends much less on epilepsy than they do on other diseases affecting fewer people. Epilepsy kills people. 50,000 people will die every year of epilepsy. It is critical that we bring epilepsy into the light where we can create cures to save lives.
Mickey's Miracle is an amazing organization. I think it's really important to shed light on this disease. I think it affects so many people, but interestingly, there are so many people that don't know about epilepsy and what it means and how it affects people, patients, and their families. And so I think it's really important to bring awareness to the world so that we can continue to do things like raise funds for research, and so we can learn more and hopefully we can end epilepsy.
Understanding the mechanism of epilepsy, like our ability to understand the genetic underpinning of the epilepsy, tells us where the genetic abnormality is and affords us the possibility of designer drugs that may stop or block the epilepsy. There's also movement afoot to improve our surgical techniques so that instead of necessarily removing whole sections of the brain, we might be able to laser a certain area and thermally ablate or disrupt the epileptogenic focus. And then there's deep brain stimulation and responsive nerve stimulation that has the possibility of electrically interfering with the electrical mechanisms that produce the seizures to begin with. So I think there's a lot of active research to change the landscape and improve things.
Imagine a world where those parents go in after months or years of misdiagnosis and suffering, and rather than the doctor saying, I'm sorry, there's nothing we can do, the doctor says, we now know what your child suffers from. There is a treatment or there's a cure, and here's the plan. That's a different world than we've lived in really for all of our lives. But I think it's finally here, and that's what's so incredibly hopeful.
I feel with the Mickey's warrior families, you don't feel alone. There's someone out there that's going through the same thing, and they understand everything that you're going through, and they won't judge.
Connecting with Mickey's Miracles has really reinforced the things that I'm doing and has helped me try some different therapies and get to a place of acceptance, or trying to get to a place of acceptance. And I love having, you know, a professional advocate in our corner. That's huge. And every time I have ideas, I can bounce them off KRISTIE, and we can talk about really complex stuff like medications and surgeries and stuff that I can't just talk to anybody about. You really have to be in the know. So it's been a really big help.
We were in the wrong hospital, but we had no idea, and it wasn't until KRISTIE GRIESS reached out to us and helped get us to the right hospital and literally saved his life. And he's now seizure-free.
I think that as families are so desperate, and they are just, they're in such a hard place, and I feel like I can help them to not only help their child, but to come out of that bad place and to really enjoy life. And when I've seen my surgery kids finally able to really enjoy life and not worry about having the next seizure, it just really changes their quality of life, and it gives me so much joy to see that I can be a part of that process for them.